Yes, okay,
Yeah.
okay. It's going. It's moving. Just a moment. Almost. Okay. All right. Live stream is up. Okay. I think we are good to go. Mandela, I'm getting an echo. I don't know. Feedback from me. Okay. All right. Hello, everyone.
Yeah. Hi, Nadu. Good afternoon.
Good afternoon. Hello.
So pretty. Hi, hello.
Hi, Didi. Welcome. Thank you, everyone, for.
Thank you. Mommy.
I don't know. I'm getting a lot of feedback. Yes. We'll be starting around 3:10. I want to give it some time. The numbers go up a bit. Then we'll take it from there. Okay. Hello, good afternoon, everyone. Thank you so much for taking time out of your busy schedule this afternoon for joining us on this special webinar on breaking the silence and saving lives, a multi-sectoral dialogue on breast cancer. My name is Nadu Iraja Adipo, and I'll be your moderator for today. We commission this webinar in the name of the Father, the Son, and the Holy Spirit.
Amen.
I want to quickly move straight to the agenda by inviting, before we move to the opening remarks, would want to share a brief about Repo Health Unfiltered, who we are, what we do, so that you have a full idea of the entity and what we stand for. So we are going to just give a 30 seconds video to understand who we are as Repo Health Unfiltered. Mandela, if you could show the clip. Okay, so while we wait for that to be sorted, I want to invite Mr. Archibald Adams, the communication lead for Oxfam in Ghana, to give us the opening remarks. Over to you, Mr. Adams.
All right. Good afternoon, everyone. It's a privilege to be part of today's webinar. I see that we have a wide variety of range of people here. And today's dialogue, basically for me, and I'm sure for you also, reminds us that breast cancer is not only a health issue, it is also a developmental issue. Obviously, when we have a lot of cases on breast cancer, it affects families, it affects the workplaces where we find ourselves, businesses, the communities, and then the entire society as well. Too often, a few of the times we've seen and we've interacted with people, we've seen that fear and stigma prevent a lot of women from seeking help. And we are hoping that with this dialogue where we're going to share knowledge, where we're going to share experience, where we're going to teach people how to do it, we can spread and begin to get to people one person at a time, ensuring that we can update people's knowledge and then encourage them to take that bold step towards early detection and then treatment. Indeed, awareness saves lives. So I'm very grateful to Ripple Health Unfiltered for creating this platform and for giving me the opportunity to share these few words. I have so much confidence in the speakers, and I know that they are going to share a lot of knowledge with us. So please relax, get yourself some glass of water, get your notebook, your pen, your tablet, and be ready to be empowered more knowledge so that we can move from here as a webinar to a movement, making sure that with one voice, with one action, we can save one more life from breast cancer. Thank you so much, and I look forward to picking up some new knowledge and expanding my network as well. Thank you. Over to you. one voice with one action. We can see
Okay.
one more live
All right. Thank you
from
so
first
much.
answer.
So
Thank you so much, and I look
our
forward to
opening remarks
picking up
was
some
given
new
by
knowledge
Mr. Archibald
this morning by
Adams, the
next
communication
broadcast.
lead
Thank you. Over to you.
from Oxfam in Ghana. Just a brief about him. He's a global communication strategist and the founder of Voice of Advocacy and expert in diplomacy and international relations. Thank you so much, Mr. Adams. So I will proceed to share a brief video about who we are as Ripple Health Unfiltered. So I will proceed to share a brief video about who we are as Ripple Health Unfiltered. So I will proceed to Okay, so that's Ripple Health Unfiltered and what we do. We want to quickly move on to our first business of the afternoon. Is to Okay, so that's Ripple Health Unfiltered and what we do. We want to quickly move on to our first business of the afternoon. Is to Okay, so that's Ripple Health Unfiltered and what we do. So we are taking our keynote address from Dr. Carla Pinto. She is a family physician based in Chicago, Illinois, in the US, very passionate about serving underserved communities and has a special research interest in cervical cancer both in US and in West Africa. She is a co-founder of the online platform. Just so not to butcher the name, I'll say the English one, which is we can have good health, a social media platform dedicated to educating every Guinean in Guinea-Bissau and in diaspora about various health conditions, including cervical health, a social media platform dedicated to educating every Guinean in Guinea-Bissau and in diaspora about various health conditions, including cervical health, a social media platform dedicated to educating every Guinean in Guinea-Bissau and in diaspora about various health conditions, including cervical health, a social media platform dedicated to educating every Guinean in Guinea-Bissau and in diaspora about various health conditions, including cervical. Okay, so Doc, over to you if you can hear me.
Sure, I can. Thank you so much. Good morning to those who are watching. Welcome to this Breaking the Silence, Saving Lives. Thank you so
Doc,
much for
over
this
to you if you can hear me.
presentation. Sure, I can. Thank you so much. Good morning. Let me know if you can
Yes.
hear me well. Who are watching. Welcome to this Breaking the Silence, Saving Lives. Thank you so much for this presentation. Sure, I can. Thank you so much. Good morning. Let me know if you can hear
Can you
me
hear me
well.
well?
Welcome. I just hear an echo, but I wanted to just make sure that everyone is hearing me well. Thank you so much for this presentation. Yeah. Okay. Regina said yes. Okay. Thank you. Very good. Very good. Thank you so much. So if you can move to the next slide, please. Thank you. Yeah. Okay. Regina said yes. Okay. Thank you. Very good. Very good. Thank you so much. So if you can move to the next slide, please. Thank you. Yeah. So we'll have the objectives for today that I would like to speak about. We will be focusing on looking at few things. Do you want me to share my screen instead, or what do you prefer, Nadu?
Yeah, you can go ahead and share your screen so that it's much easier.
Okay, I think I'll have to request if you can give me powers, I'll share it.
Yeah, you can go ahead and share.
Very good. Okay, can you give me a thumbs up if you're seeing my screen? Very good. Okay, very good. Thank you. Okay, so for the objectives for today, my focus is to really for us to look at the impact of breast cancer in the world. We will look at what are the challenges regarding breast cancer, both in Africa and in West Africa. We will also be looking at symptoms of breast cancer, diagnosis and treatment, and we'll also look at the importance of survivorship and also looking at guidelines. 1 second, just want to make sure. I'll stop sharing and share the most updated one. Should be this one. Yes, correct. And I believe you can see it. Very good. Yes, very good. And so let me dive in, continue to share. One of the things that I want us to focus on and is not only to think about breast cancer as a condition that can impact so many lives, but also to look at the reality of breast cancer where we live in. And I know this audience, we have majority of people from Ghana, so I have some information from Ghana as well. I'm originally from Guinea-Bissau, so we're all in the sub-Sahara Africa, so some things do apply the same. But we'll also delve a little bit deeper of what's the situation of breast cancer in Ghana. So the impact of breast cancer in the world. So in 2022, they found that this is based on the World Health Organization, that about 2.3 million women in general in the whole world are diagnosed with breast cancer. In that year, that's what they found. And about 670,000 of them died of the disease. The other fact that is important to keep in mind is that over 90% of high income countries, when they have patients that have been diagnosed with breast cancer, and there's 5-year survival rate is over 90%. But in countries like India is a little bit lower, is 60%, and in South Africa, about 40%. Now, looking, if we to make it really easy, it's like in high income countries, so 9 out of 10 survive of breast cancer and they have this 5-year survival. In India, about 6 out of 10, but in South Africa, it's like 4 out of 10. Now, let's look at the impact of breast cancer in Africa and in West Africa specifically. So in Africa, they say that per year, you might have 17.3 per 100,000 people die of breast cancer. But it's interesting that in sub-Sahara Africa, about 45% of all low-income countries, about 45% of them are from from all the countries, that low-income countries that have individuals that die of breast cancer, about over 180 something thousand, 45% of them are from sub-Sahara Africa. So almost 50% of folks that die of breast, or the ladies or women that die of breast cancer in low-income countries, 45% of these people are from sub-Sahara Africa. So you see that this is a huge problem. And we will delve a little bit why this is the case. In Ghana, like an average, every year, you might have about 2,900 women that are newly diagnosed with breast cancer, and about 363 of them die of breast cancer. And so this is important for us to keep in mind. And I've been reading some papers that say that mainly in our area in sub-Sahara, the reason why we have, yes, we might not have high incidence like new cases of breast cancer like developed countries, because in developed countries they have machines, they're able to detect quickly. But we have higher rates of deaths because one, there is like a late detection. So women usually might have breast cancer, but they do not notice that there's cancer until it's in a later stage. And by the time they go to see the doctor, it's already advanced. Or it could be a delayed in diagnosis where they might have had symptoms, but maybe because of lack of resources or not being able to be at an area where it's easy to do mammograms, they diagnose the disease later in time, or as well because of poor access. So sometimes women have to travel villages or even towns to find a doctor, have the financial means to get there to be diagnosed. So we'll look at some symptoms of breast cancer. I was looking at there was an article that was actually published from I think it's Bibiani Municipal Hospital is a hospital in Ghana, that they did a survey. It was very interesting. They did a survey looking at women, women's understanding and knowledge of breast cancer risk factors, breast cancer symptoms, and even the awareness of breast cancer. And the interesting thing about that study was that they said over 80%, and it was a total of 160 women, but over 80% knew about and heard about breast cancer, but only like about less than 50% knew about the symptoms, what were the symptoms, and less than 50% also knew what were the risk factors of having breast cancer. So we'll look at the symptoms in detail. So if you can see my cursor, and so basically like this is just the normal breast, and we just will look around through each symptom and see what to expect. So one of the common uh, symptoms that women might complain is having nipple discharge. Now, it's important to differentiate from a woman that is breastfeeding, because it's different, right? The milk is white, and they are breastfeeding. But usually when we say nipple discharge, is basically when it's in a irregular kind of fluid that comes from the nipple, can be dark brown, orange, or looking bloody in color. And I actually had a patient that actually presented with this symptom. And the strange thing was that she actually had black uh, bra. So it was hard for her to notice. But it was when she had it on her shirt that she noticed, oh, this is odd. Or sometimes this discharge, it can look crusty on the bra over time. So it's important to notice that that is not normal, especially for women that are not lactating or not breastfeeding. If you notice that there is a discharge in your nipple, please see your doctor. Another one is the lump under the arm. That is very common as well, and that is also seen more in individuals or women that have either breast cancer. It's already impacting a lymph node. So the nodes are usually very small, and you have to press to really feel them. But if you lightly touch under your arm and you see that there is a mass that was not there before, that's a sign. That's a sign too. Also, when you look at complete swelling of the breast, so the whole breast, if you notice on this breast on this side, is more swollen on the other side. So it's important to keep in mind. Also having irritation of the skin, or having any nipple pain or a pain around the nipple, close to the nipple, that is not normal. Seeing skin dimpling, meaning that even the skin of the breast looks either different or looks like the peel of an orange. We call it peau d'orange. It is a very is like a sign that it is really not normal. The skin should always look very smooth. And then if you have swelling, in the breast, so you can see this little lump in the breast itself, or if you're in the nipple, you see that the nipple is retracted. Usually it should be pointing out, but if you see that it's retracted like this, that can be as a sign that there is breast cancer. And this is just an example that you can see, especially on our darker skin. You can see that the skin looks like an orange, literally, and also the nipple is retroverted. So it's not, it was inverted, I would say. So meaning that it's inwards, and we don't want that. That could be a sign of breast cancer. So what are the screening tests in ways that we can diagnose breast cancer? One of them that is the basic one that anyone that is listening to me, or if you, speak to patients or to women, you can share this, is on self-examination of breast cancer. In the past, here in the US, they used to have this for doctors to do it as well to women, but they realized that there was a period of time that a lot of doctors were doing breast exams. But the problem was that they would feel something, they feel it's cancerous, they would send them to do exams, mammograms, and it was not. And they realized that, instead of doing that, people were getting mammograms and they were fine, they were normal. And so to reduce costs as well, they with studies, they found that it's encouraged for patients to do it. And we usually do breast exams if the patient comes here with symptoms. So one thing that I usually recommend for women to do is always to have their fist in their hips, like a boss when doing the breast exam. Have, stand before a mirror so that you can look to see if both breasts, they look normal and symmetrical in both sides. Sometimes that there might be a slight, normal, not change, but normal discrepancy where you can see one a little bit smaller than the other. But pay attention if it's something that is like noticeably different. And the other thing that you could do is have your arms down. You can stretch them out like we see here in the mirror. And you can raise your arms as well up to see if there are any lumps underneath your armpits. And the other way to approach it as well, so you're first doing standing, then the other position is doing laying on a bed. Just because when laying down and having your arm up, you're able to spread the tissue from the breast, and it's easy to feel the breast in itself to see if there's any changes or any growth or any lumps. And the way you could do it is first starting from outside in a circular form and go all the way in. You could do also, then the next step is doing like a star shape, but going outside in 6 different directions. And lastly, you can do up and down throughout the breast. And also at the end, also check under your armpit. You can also do it under the shower, just because with shower you have more lubrication and you have something smooth in your fingers to really feel your skin and feel if there are any lumps. So looking at some of the diagnostic tests. So yes, we can do the manual, but if we feel anything, if we notice anything or any of the symptoms, then the next step would be to see the doctor. Usually, depending on age, depending on what we're finding, we sometimes select ultrasound and mammogram or both. Now what we've been doing is for screening, women go straight and they have the mammogram if they're 40 years or older. If they come and they're less than 40 and they have a lump, let's say that they're 38 years old and they have a lump, and let's say they have a family history of breast cancer, then would have them do a mammogram and an ultrasound that is a little bit more specific. And then regarding the biopsy, we do it when the mammogram shows that there is a mass that is abnormal. Then the next step would be to extract the tissue from that mass to look under the microscope to see, or the pathology of it, we call it, to see if it is benign or if it's malignant. So what are the methods of treatment and how do we treat breast cancer? So let's say we have a patient that comes in, that gets the mammogram, has the biopsy, it's confirmed that it is cancerous. Then what are the next steps? The next step, there have now we have more methods of treatment where like the specialists, the oncologists that are the specialists for breast cancer, they determine based on risk factors, based on the size of the mass, they know what the next step would be. So one of them is either partial resection, where they remove the mass or the part that they believe that is infected, and they check under the microscope if the surrounding parts of what was removed, if they're clear or if they're not clear. And if they're not clear, that means that they have to go in and get more. Sometimes women might have total resection, meaning that they take everything out, depending on how, the disease has spread, or also thinking about risk factors. So if they have a genetic predisposition for breast cancer, they might select to have a total mastectomy to get it out. And to get everything out. Then the other method is radiation, where they have high energy rays that go to impact. Basically, they go in their goal is to basically hit the impacted cells or the cancerous cells. So radiation is a method of treatment. Chemotherapy is another one where you have certain medications that target DNAs of cancerous cells, and they get it IV. And then you also have hormonal therapy. Now, with the hormonal therapy, where they give them this hormone to prevent them from having cancer again in the future. I remember one of my patients that she had a resection, a partial resection, and then they determined because she had cleared margins, she did not need to continue on the hormonal therapy in the future. So it all depends on the risks. So let's look at some screening guidelines. So in terms of screening, which is basically mammogram is a test that we do, and we have standardized guidelines to capture, and the main goal is to try to capture those people that are at risk and rule out anyone that is not at risk. So we know that breast cancer, the risk of having breast cancer is an older age. So we start in some countries 40, 50, but now since we're seeing more like a younger population with breast cancer, they recommend it to start like around 40 years of age to 75 years of age. Now we have baseline risk factors. So women that are more in the heavier side, because of the exposure to a hormone called estrogen, are more likely or like are more at risk, I would say, to have breast cancer. Or even in terms of having children, they found that women that have children less than 30 years of age have a lower risk of having a breast cancer than women have children older than 30 years of age. This all has to do with the exposure to estrogen, like one of the hormones that can be related to breast cancer. And other high risks that we think about in screen. So these are some of the risks that we have in mind that can lead people to have breast cancer or women to have breast cancer. But the screening is we start at 40. If you have any symptoms, then you talk to your doctor and they'll recommend you to know like which one should you do. If you should do a mammogram or just an ultrasound or both. Now, if you fall under the category where you're high risk, that means really higher than average. That means if you have a gene that is called BRCA1 or 2 gene, is a gene that women that have this gene have a high tendency of getting breast cancer. If let's say a patient or a woman comes and her mom has this gene and she had breast cancer, so many times instead of waiting till 40, we have them screened earlier. So at age of either 25 to 35, depending on the age when mom was diagnosed. But we have them screened earlier. We also have them seen a genetic specialist to test and see if they have this gene, or if they have like a first degree family member with the gene, or a first degree family member, mother, sister, daughter, with breast cancer. And I would even say sometimes we think about women, but men as well might have this risk as well, because if this BRCA gene is in the family, and they also might have male individuals that have this not only gene but also have breast cancer, they can also be at risk. Their children can be at risk of breast cancer as well, male individuals. So the males. Or if a woman or has been exposed to radiation less than 30 years old. So let's say maybe they had thyroid issues and they had to have radiation, or maybe they were diagnosed with leukemia and they had to be uh, exposed to radiation at a young age. So that we screen them earlier. Or if they were diagnosed with a malignancy syndrome. So there are different types of syndromes, like Lynch syndrome. Like there are different types of syndromes that sometimes it makes the individual at risk of not only breast cancer, but it can be breast, ovarian cancer, uterine cancer, and other cancers. So if they have any of those syndromes, they might start with an MRI every year from ages 25 to 35, and they might also start with mammogram at 30 years old instead of 40. And so if an individual is found to have, or a woman has found to have or even a male, say, sometimes it can happen, they might have breast cancer, but if they're diagnosed with breast cancer, it is very important that they have a support system. We know that survivorship care is very important, more than just a group of survivors that come together and share their experiences. There are other pieces that can also be instrumental in the survivorship care, where they might have a health coordinator that helps them coordinate the scheduling, their appointments. Also, I know in some of our countries we might have community health workers that usually check on patients and see what they need, or maybe they might also have access to either a nutritionist or classes in cooking and eating healthier. They also might have sessions like this where they have specialists that come in and share their knowledge about the disease. They answer questions. Also, that many organizations support survivorship groups with funding, in terms of supporting financially, the impact in caregivers, the impact in patients. So there are many facets of survivorship that are very, very important, to take uh, to acknowledge and take heed of. And so my encouragement and my call to— Can you hear me? Okay. My call to this is just to say that now that this is my last slide, is that if you're listening to me, and you are 40, I encourage you, strongly encourage you to always see your doctor for screenings for not only breast cancer, but any other cancers. Always be aware of what are the resources that are around in your community, to know what is available, and also make sure that you're taking care of yourself. One of the important things that I in my practice that I notice is that women many times they give themselves and give to their children, they give to their spouses, they give to their community, they give to their jobs, and they take care of themselves last. And one of the hard things is to see the impact of breast cancer. And many times you talk to them, it's like, oh, I should have taken care of this earlier. I noticed the signs, but I thought it was normal, and I realized the importance of remembering that you are important. And if you're not well, your family, your children, your job will not be well. And so I encourage, if you speak with women, or if you're yourself listening to this talk, that you take care of yourself. Because if you are well, everybody else will also be well. So if you're doing so much for others, they need you to be well. Thank you so much. And I also wanted to give the space if anybody had any questions, any concerns, any they want to share, they can also share. Thank you so much, Nadu, for this platform, to give me the opportunity to share. And I just hope that more people will have the opportunity to have access to resources in Ghana regarding breast cancer. Thank you so much.
Thank you so much, Dr. Pinto. So we've just to reiterate some of the key takeaways I've taken it. Your body matters, and also particularly in all my knowledge, I never knew like having a trait of a gene could increase your risk factor for breast cancer. So that's a new added knowledge. That's the BRCA1 or 2 gene. So that is a great learning on my side. So just to say, because of the time difference, Doug may not be with us to the very end. So I want to open the floor for few questions, as many as would want to, pose a question to Doug. Feel free to, you can use the reaction button to raise your hands, then I'll give you a head, or can drop your questions in the chat and I'll gladly read them to her so that she can respond to it. So the floor is open for any questions for Dr. Pinto. Okay, so you have a thank you message from our Mr. Archibald Adams, the communication lead at Oxfam in Ghana, who gave our opening remarks, says thank you and he has learned today. So, ladies and gentlemen on the call, question for Doug, or we may give her the opportunity to exit the meeting for now. Just giving 1 minute to see if there's any questions coming through. Okay, I have Neofe, you may go.
Hello, Dr. Pinto. Wonderful presentation. I enjoyed that. Please, I would like to ask for the chemotherapy. Usually, as usual, some informations do come from social media, and I have seen this cancer treatment from several people who create content about it, and there are some conspiracies about it that sometimes it doesn't really cure you, and in the end you may end up attracting certain infections. And I looked into the chemotherapy as well. Please, can everyone hear me though?
Yeah, when you were coming in, I attended.
Hello?
Yeah, you may go
I
ahead.
can hear you clearly.
Okay, great. And so I looked into the chemotherapy, and then got to know that sometimes I don't know how often, but it inhibits the production of new cells, and as this happens, it also opens one up to infections and other things. I'm trying to get an answer to that, something
Yes.
to let me understand. And then with the radiation therapy, I'm thinking, is it that okay, this radiation is good, or that also has its effects? Because I believe exposure to radiation is not ideal for us
Yes.
as humans.
Yes, yes. Very good question. So regarding the first one, yes. So chemotherapy, there are different types of therapy, and their target is the DNA of the cells. So the important thing to remember is that in every medication, man-made, there's always side effects. That's just for baseline. But the chemo, its purpose is to kill the cancer cells. So some of them are targeted to go to those cells where they're replicating and break them so that they don't continue to replicate, because we don't want the cancers to spread. The only downside of it is that it also can affect, we call the stem cells. The stem cells are the basic cells where all other cells are formed. And so the consequences of that is that many times, even the stem cells that we need for our skin, that's why, or for our hair, that's why people, when they get chemo, their hair falls off, because those stem cells that help growing the hair, or some of them are wiped out. Also, it can lead them to have loose stools. Those cells that are good for our gut, they're not able to absorb much of the food that we supposed to absorb. So the thing is, although the target, yes, is for the cancers, but it can also hit our stem good cells. But the thing is, this is where science and some people have survived through this, where there is a risk where at expense for a period of time, your good cells would be wiped out, but at least it will kill the bad cells, so it kills the cancer. And it gives time for, even if your good cells die, they end up reproducing again. Now, yes, there are side effects to this where, like you said, for example, with radiation specifically, and I even mentioned it, if you are exposed to radiation when you're less than 30, you're also at risk of having, cancer in the future. So yes, there is a risk for it, but again, the question is at what expense? So we rather do interventions that would give and help preserve life instead of letting the patient just die. You see what I'm saying? So the thing is, like, with all the research that has come, and unfortunately I would say it's not my area of expertise in terms of these two treatments, because that's not what I treat on a daily basis in terms of seeing patients. But with the little that I know is the fact that the focus is to at least address the cancer and help save the life. And with time, that's why you see with patients that, their hair falls off, but over time, their hair grows again, right? And yes, there's a risk for having cancers in the future, but right now we can kill the cancer and manage the care and hopefully, have patient engage in a healthy lifestyle, not to create more risk for future cancers.
All right. Thank you so much, Doc. So I have two questions in the chat for you. One for Miss Regina Mensah. I said, thank you so much for a wonderful presentation. Please, I would like to ask, if you are a young boy and your father's sister is diagnosed of breast cancer, are you in any way at risk? And just to add a last question from Joshua Adi, he says, hi, Doc, great presentation. I just wanted to ask, is it possible for a breastfeeding mother to develop breast cancer since some signs involve white discharge? Could that be confused with breast milk? Yeah, thank you, and over.
Yeah, that's a very good question. So I'll answer Regina's first. So in this case, an aunt, in this case would be the father's sister, right? So an aunt is not a first degree, I would say we'll consider more a second degree. We would also look at how many. So if it's just one case, excuse me, it's good to keep in mind, one, that you do have an aunt with breast cancer, but then we also ask, did this aunt, was she a smoker? Because smoking is also a risk factor. The other thing is, well, how old was she? Was she more like in her 60s, or is she like young in her 30s? Because the other thing is, here in the US, when women are diagnosed with breast cancer, they usually do a genetic test to see if this is genetic. And if it is genetic, then that's when the women in the family should start getting checked. And even if you are a boy, in this case, the main thing is to look at, did your father or any male in the family had breast cancer? Because if a male has the breast cancer, then you are at risk of having breast cancer as well as a male. Okay, so that's important to keep in mind. And so I would say there are many factors that we'll have to ask to really know if this young boy would have breast cancer, like I mentioned. And the answer to Joshua's question is interesting. So you might be breastfeeding. Yes, it can, you might think about confusing with breast cancer. The main thing is, like, one, color. Two, you would also see other signs. Sometimes with breastfeeding, sometimes you can have we call mastitis, is when you have basically an infection or a clogged duct that breast is not able to go through. It stays there. It is painful. That is more of an infection. It can be an infection or an inflammation. It is hot. And usually for that, we have things that we do, the antibiotics that we give. But the main thing I would say with the discharge, you would clearly see the difference of the color. You'd see that it's darker in color, which is usually not that normal. If it's like breast milk, you notice it's bright, is white. But if you notice there's orange in it, bloody stained, or browned, that's not normal. that is not, it should, is not even, there isn't even a concern, is there bleeding somewhere? And so that would not be due to breastfeeding. So you'd see a distinction between the two. So I usually recommend any breast, especially for first mothers, because anything is new for them. It's always go to your doctor, and it's so important for them to examine you to distinguish between the two.
Okay. All right, Doc. Thank you so much for the time and the knowledge shared with us, ladies and gentlemen. I want to say a big thank you to Dr. Carla. You can follow her on LinkedIn, stay connected with her. She has a lot of wealth of knowledge, and I'm grateful that she offered to be part of this session. Thank you so much, Doc, and
Thank you so
hopefully we'll
much.
have you more on future sets.
Sounds good. Thank you so much, everyone. Now
You're
just stop
welcome.
sharing and have a great session. Bye.
Yes. Thank you so much. So next we have a breast cancer survivor among us who is going to share her testimony, more of her journey from diagnosis straight to um, treatment and life after breast cancer diagnosis. So, ladies and gentlemen, I want to introduce to you Madam Benita Bona. She's on the call with me. Benita, if you can hear me, you can just unmute and say hi to our audience. Hi, Benita, can you hear me? Hello. Oh, I'm not the one who's audible. Okay. So whilst I get in touch with her to figure it out, before we move next to our panel discussion, we just want to take an interlude. So, okay, I think I see her video on. Madam Benita, can you hear me? I see her video on, but we can't hear you. Madam Benita, can you hear me? Okay, okay, all right. Thank you so much for making time to join us. Maybe we can begin by introducing yourself. I wanted to leave that with you to our audience, then we'll go through with our discussion. So over to you. I think we can hear you, but the network looks like there's a lot of lags. Okay, so how about Madam, I give you time so that we can sort out the network, then we'll come back. Okay, is that okay? Okay, so all right, so I just want us to move on and take the interlude from okay. So Madam, how about you turn off your video and let's see whether your network would improve. You can turn off your video. Okay, yes. So okay. So can you hear me now?
Yes, I can hear you.
Aha. Okay, I think it's better with the video off. All right. So the floor is yours. You can tell us about yourself, then we'll carry on the conversation from there.
Okay. Thank you so much for having me. And thank you, Dr. Kala. That was insightful. Actually, breast cancer wasn't new to me. I encountered breast cancer 2001 when I lost my mother to breast cancer. You know, doctor was talking about some of the risk factors, like having someone who has breast cancer already in the family. My mother had was diagnosed with breast cancer when she was 37 years old, and then she passed on when she was 39. In fact, I saw all she had to go through, the stigma that was being attached to her, the pains she had to go through, the hospital visits, and a whole lot. Her prayers were just endless, you know. And then a growing up young lady, watching your mother suffer like that, and there's nothing you can do to help her. It was very traumatic. And then finally, on that fateful day, she died. She died while shedding tears. Then I never understood why the tears, but I think now I understand it very well. She did, and finally she passed on. And when she died, I made up my mind immediately that I was going to be a breast cancer advocate, that I was going to tell people about cancer, that is not something wait until it happens to you. I was going to tell people to go out there for screening and early detection. But you know, the fears of even going for screening was just what pulled me back. I never went for screening. And, you know, as a Christian, I was faithing it, praying that what killed my mother would not kill me, and all that. And life went on. So, 2018, on this particular day, I was taking my bath, and I decided to do the self-examination, like doctor said. Whilst I was just going around my breast, my hand touched this lamp. Of course, if it was painful, I would have gone to the hospital. So it was painless. And when my hand felt the lamp, you know, that time your heart will sink into your stomach. That was what happened to me. Everything in me started telling me, you are dying. See how your mother died. It is cancerous. You are dying. I was shivering in the bathhouse. In fact, the water on my body had to dry up. I was lost in my fears. And coincidentally, my mother died leaving 5 of us, and I'm also having 5. So a lot of thoughts kept ringing in my head. I was like, is this spiritual? Those who killed my mother, because when my mother died, they told us that some people killed her. So I was saying, those who killed my mother, are they also coming to kill me? What have I done? I was lost in my thoughts. And I was just alone with the kids, having 5, and husband has traveled between pastures. Alone with the kids, and the eldest was the young girl. I was thinking, how am I going to do all this? And then I saw the house. I my mother died from this. So she said there is a hospital I'm going to direct to that. They are very good. They are very good with supplies. You go to twice, do the prayers. And I'm grateful to God that she gave me that that advice, because that I was that comes to my way, I want to do. I didn't want
Benita, we are losing you. The network is not. If you could reposition yourself briefly, because we are hooked to the story, but we are losing you. Yeah, we can barely hear. So maybe let's take that again.
Can you hear me?
Yes, yes, it's better now. Yeah.
Okay. I don't know where it's coming from.
Now the network has dropped again.
What should please, where should I come in? Like, please,
Come
can you hear
again.
me?
Yes, we can hear you.
So please, where should I come in from when I
No.
confided in my pastor's wife?
Mhm. Yes. Mm.
Okay. So I told her, and she said she was to direct me to a hospital. They know that are very good with staffs like this, that if I get there, she's going to be doing the prayers. So I had to come to Peace and Love Hospitals at the Spinters Road. When I got here, I was still praying. I intensified in my prayers. I was saying, God, I don't want it to be cancer because I saw what happened to my mother. I don't want it to be cancer. You know, when a mother dies, leaving their children, we just decided to face life, and everybody just had to face life. And I don't want that to happen to my children. So when I came to this place, Peace and Love Hospitals, they said, Benita, yes, there's actually a lamp there, but not all lamps are cancerous. So it kind of gave me 50-50 chances. So I intensified in my prayers, saying, God, please, I don't want cancer. So they told me I was going to do further investigations. I was going to do the breast scan. I did the mammogram, and I did the biopsy, the core biopsy. Doctor explained it, Dr. Carla talked about it, where they have to take a sample of the tissue to the pathologist and know what kind of cancer, kind of treatment, what stage or grade that, and in fact, in all, how to go about the treatment. And when they did the biopsy, those times I had to wait were the worst days in my life. You know, when you sleep and all of a sudden you just get panicked and you wake up in the middle of the night and your heart races back to the test, you're like, what will happen? So uncertainties. I would rather say the fears of breast cancer was what would have even killed me, not the cancer itself. And then when my report came in, I went to Kumasi to meet the Dr. Mrs. Beatrice Ajay. When I got there, I was someone who I don't like taking drugs. I don't like going to the hospital. I'm in that group that when I'm sick, so I said, if I go to the hospital, the doctor, and it's not what I want, I run away. Of course, I don't even know where I want to run to. I was filled with a lot of things. And so when I just go to see okay, to say, hey, I don't even, I'm scared in my life. I don't know how to explain how I felt. Where I was sitting down, my legs were shaking. My heart was beating so fast. I didn't know what to expect. You know, having the thought of my mom and all that, everything came back. And when it was my turn, I got to the office. When I opened the door, what I saw, like, she gave me this smile. I saw a mother figure in her, and then the atmosphere was so welcoming. It had to like calm me down. I saw a mother in her, and the way she like smiled and said, "Oh, my daughter, come in." And then when I went in, she asked me to sit down, and she said, when she looked at the paper, She looked at me, she said, Benita, it is cancerous. You have to start treatment immediately so you stay alive and take care of your children. Immediately I heard those words from her, I think every fear vanished. Of course, I've heard what I want to hear. What is the way forward? And then the words kept ringing in my head that Benita, you need to start treatment immediately so you stay alive and take care of your children. I was like, so this thing is survivable. All that's why I'm thinking, what is cancer? The person is dying. So coming from a doctor telling me that you need to start treatment immediately so you're alive and take care of your children, it's survivable. So I made up my mind that whatever they tell me to do, that I was going to do it to be fine. And I also made up my mind not to call any of my aunties or my uncles who saw what my mother went through because they had to push her around. You know, at that time she was vulnerable. They had to tell her to go to this spiritual house, go to this prayer house, do this. So I didn't want that to happen to me. But there are some people that in your family, when they talk to you, you wouldn't say no. They will kind of say you are disrespectful. They are trying to help you. So I didn't tell any one of them. Immediately, I started my chemotherapy. I did chemotherapy, a lot of side effects that has to do with chemotherapy. I lost my hair, quite all right. When I lost my hair, a lot of people die today because they don't want to lose their hair. When I lost my hair, I did a little makeup. I put the picture up there, Facebook and WhatsApp status. So my friends started chatting, you that you did that. But they didn't know chemo hair. So I just tried to turn the negative part of it into positivity and it worked for me. I did 6 rounds of chemotherapy. I did surgery, mastectomy to be precise, the removal of the whole affected breasts. I did mastectomy, and so far so good. In few months to come, maybe April, May, I'll be 8 years survivor. So I'm here today to share my story to encourage someone. And I should tell people that early detection and prompt action is what saves life. I tell you, treatment is very, very, very expensive. In fact, I have to beg to be like, and some people they tell you, they come to hospital, they don't have the treatment, they go back there, they go back there before they come back again. It has become something that that will only manage. And then secondly, so is why just say well, you are sick because we are still on drugs. Some of us are still on drugs between 5 to 10 years. Daily drugs, I tell you. We go for checkups. We still do the breast scan, we do the mammogram, we do the CA15, what we call the tumor marker, where they check if anything is rising up or whatever, so they can put it down. So in all this, it is finance. So after the cancer treatment, you say you can barely feed, and then you are talking about going to hospital for checkups. So those women just sit back. So that is why in most cases you see reoccurrences. So I am encouraging everyone here today that and another thing I want to say, it will surprise you that most people that are being affected, they are the very learned ones, the educated ones. Some of them, when they say this thing, I don't know the reason why. A lot of them, they keep it to themselves. I don't know. And maybe the stigma. We also advocate for people to stop stigmatizing those with breast cancer or those who survived it. Some people say it's spiritual. Oh, like the way my mother died. Some people say, oh, who knows what they have done in the family that is following them. And then I went somewhere and someone introduced me as a breast cancer survivor. The person quickly, the other one quickly said, oh, Jesus, it is not my portion. Cancer can never happen to me. It is not my. At that moment, it can be depressing. It can weigh me down. It can weigh me down because whose portion is it? It's not one's portion, but it's something that can just happen to everyone. So today I share my story to encourage someone out there and also to tell someone out there to remember the survivors, remember the fighters. BCI, Dr. Mrs. Beatrice, we have here, like, she's doing a lot. She's doing a lot. Some to the hospital and they don't have anything. She kind of assisted in medications. And you not believe it has for 10 to come to hospital to take the free medication is even the problem. And the worst is that most cancer survivors become automatic singles. Automatic single mother. The husband there with the man leaves her. She just so thank you.
Alright. Thank you so much. Please let's appreciate Benita in the chats. It takes a lot of to share your story. Even though the network tried to get in the way, I think the core messages were passed on. And Benita is advocating that we do not stigmatize against persons who are experiencing breast cancer or have survived it. And I just want to touch on what he said that most of the treatment comes with money. And just to mention, Benita is with a foundation called Breast Care International. So you can just search them up, just Google Breast Care International, and they do a lot of amazing things. You can also donate to support treatment of and even give sustenance to the neglected survivors and all that. So thank you so much, Benita, for sharing your story with us. To go through 6 rounds of chemo and surgery and still be living your life journey after 8 years is nothing short of resilience. Thank you very much for making time to join us. All right. So, um, I don't know. I'm just led to see if anyone has some words to give to Benita, before I let her go. I don't know. It's not part of the agenda, but I'm led by the spirit. Just anybody, you can just unmute and say something to Benita for me.
Benita, this is Adelaide. Hello, Nadu.
Yes, I can
Benita,
hear you.
thank you very much for sharing your story. It's very difficult for people to come out and tell people what they have been through, and I really appreciate hearing your story. I do have a question, however, like how did you communicate your process to your children? You have 5 children. What did you tell them was wrong with mommy? And what were some of the fears they shared, if any?
Right. Thank you.
Okay. Thank you for the about the time I was diagnosed. Please, can you hear me?
Yes, we can hear you.
Yes. Yeah, at about the time I was diagnosed, the eldest was 13, and it's a boy, and then the youngest was 4. I just had to tell them that mommy is sick, and then I don't need disturbance and all that. But it's funny enough that after a few years, when I was telling them what I was going through, my other boy, who was 11 at that time, told me, Mommy, I knew you were fighting breast cancer. I said, how did you know? He said, in school, they taught us the 6 deadliest diseases. And they said cancer was part of it. And said, when you discuss with a pastor's wife, when you discuss, Mama, that I overheard you and I know. I said, then why didn't you tell me and all that? He said, no, that he didn't want to say it, but he knew what I was going through. But me, the mother, I thought maybe they would not understand because of the age that they are in. But right now, I think the eldest is about 20. They really understand it very well now. I'm having 4 boys and a girl, and the girl she's 15 now. I think I'm pulling her along so she understands all the things now.
Okay. Thank you so much, Benita. I think there's a question. Benita, there's one question in the chat for you. Said, thanks, Benita. Anything you can share on support from family and the medical system? Mm.
When I was going through life, hello.
Yes, I think we can hear you now. We lost you for a moment.
Okay. When I was going through the vitamin, I had few family friends. I had few family members who like tried to support. But I don't know how people say it. If someone helps you the first time, the second time, the third time, the person is putting up attitudes, and you see when it's not happening to you, you don't understand how it feels or what the person is going through. So I just had few family members. I think the whole thing was just on me. But right now, few years now, BCI has been doing a lot for survivors like us. Without BCI, I don't think some of us might be able to go ahead with our drugs and tests and all that. So BCI is doing a lot for survivors like us and helping us to live in.
Okay, all right. Thank you so much. So BCI is Breast Care International. They are a non-profit organization that are solely focused on breast cancer and everything in between. Thank you so much, Benita, for your time.
You're welcome.
Want to
You're
yeah.
welcome.
Want to move on to a brief interlude before we get into the second part of our webinar, that is the panel discussion. And so we have a spoken word titled Restoration by Master Neofe, a member of the Ripple Health Unfiltered team. Over to you, Neofe.
Thank you very much. Please, can everyone hear me?
Loud and clear.
Okay. So I'm starting now. Who am I now? Am I less of a woman because a part of me was taken by a surgeon's blade? Am I less of a man because of an experience? Am I still me? Or just the echo of who I used to be? We say the body remembers pain, but we forget that the soul remembers how to rise. I have wrestled with mirrors and argued with scars. I have searched for beauty in places pain once painted ashes. But today I see it. This body, this temple, is not broken. It is rebuilt, and I refuse to drown. The flames that learn to dance in the rain don't call me a victim. Call me restored. Because healing is not forgetting, it's remembering without fear. I am the epitome of a resilient body, a divine soul renewed with strength. See, I am still a woman. I am still a man. I am still human. Woe beyond measure. And I have nothing lost from me but just a sheer flesh. For what is beauty, if not the courage to bloom again? After the storm has passed, I am the return of strength, the restoration of hope, the rebirth of identity. I am the body reimagined, the spirit resurrected. The poem that pain could not erase. I will not be shut. For then again, what is beauty, if not the courage to bloom again? After the storm has passed, I am the strength. I am the restoration of hope, the rebirth of identity, and I am the body reimagined, the spirit resurrected, the poem that pain could not erase. I will not be shut. So let the world look at me and see what was not lost, but what remains, not what broke, but what endured. Because I am more than a survivor. I am restoration to us all. So to anyone hearing me, it is an experience not to wish for, but not an identity. So therefore to say again, I am not a survivor. I am just like you all. Thank you very much. This is Sni Ofer bringing you the spoken word for this webinar. I hope you have a great day.
Thank you so much, Nee. That was a powerful word. Thank you so much. Thank you. Thank you. So you are not a survivor, you are just like us all. So that has ushered us into the next phase of our webinar. And so I have four powerful people on the call to give us an insight. Breast cancer goes beyond health diagnosis. It dissects with other sectors, and it is important for us to uncover how it affects us. So joining me on the panel, I'm going to introduce them individually, then we'll take it from there. Joined us is Dr. Francis Woba. He's an obstetrician gynecologist, the head of obstetrics at the Eastern Regional Hospital. He's a public health expert with focus on sexual and reproductive health, very passionate about empowering women through education and early diagnosis and detection. Next is Madam Abuna Edubi Amwa. She is a development consultant, and she will be let me just revert a bit. So Dr. Woba will be sharing insights on advancing breast cancer prevention, screening and treatment in Ghana. And for Madam Abna would be sharing insights on how we link breast cancer awareness to gender equality and the sustainable development goals. Madam Abna is a development management expert specializing in gender equality, public health, education, and volunteerism. She is an advocate for gender equality and justice, SRHR, and youth empowerment. The next panelist is the highly esteemed Governor Love Idiama, the president of the Prolific Ladies Congress. She will be exploring the role of faith and spirituality in healing and community support. Governor Love is a visionary IT leader with over 20 years of expertise in service operations and a certified Scrum Master at MTN Ghana. She also serves as a board member for Statcom Cooperative Credit Union and also as the president of the Prolific Ladies Congress at Christ Embassy, that's the Lab Ward Incorporated. She empowers women to thrive and fulfill their God-given potential. The last panelist is Ms. Halima Yahaya. She is the gender and youth focal person of the Planned Parenthood Federation of Nigeria. She'll be sharing insights on leading youth advocacy for early detection and breast cancer health awareness. Ms. Halima is a public health professional with key interest in women's rights. She is an associate member of the African Institute of Public Health Professionals. Halima continues to be a passionate voice for underserved youth, helping to bridge gap between access, policy, service delivery through innovative youth-centered and rights-based approaches. Ladies and gentlemen, these are our panel for the phase 2 of our webinar. Thank you all so much for making time to join us. So just to get straight into it, I want to start with a question for Miss Halima. Based on your myriad of work experience working with young people, how can young people effectively use the emergence of digital platforms and social media to spread accurate information about breast cancer prevention and self-examination? Over to you.
Hello, please, can you hear me? Can you
Yes,
hear
yes,
me?
yes, we can hear you, Halima.
Okay, I'm so sorry. Please, can you come again? You were breaking off, so I couldn't
Sorry.
really hear the question.
Yes. So I'm asking that owing to your work with young people and the expertise you bring, how can young people effectively use digital health platforms and social media to spread accurate information on breast cancer prevention and self-examination? You are muted. Halima, you are muted.
Oh, sorry, can
Yes.
you hear me now?
Yes, it's better.
Okay, apologies. Thank you very much for having me on this panel session, Nadu. I'm honored to be here. And it's been inspiring listening to the previous speakers and especially the spoken word. That was very moving. And to answer your question, I would like to say that digital platforms are powerful tools for youth-led health communication, especially given the climate of social media era that we are in now. Young people can use social media creatively through short videos, infographics, live sessions such as, this webinar that we are having now, or using Instagram, using Facebook live sessions, and also story sharing to break myths and promote early detection. Importantly, content creation can be gotten from credible sources. That's one of the issues we're having when it comes to public health communication using social media, getting credible information and ensuring that this message being passed is credible. So how do we bridge that gap? By getting information from sources like the WHO website or the WHO social media sites, the cancer societies that are certified. For Nigeria here, we have the Nigerian Cancer Society, and also, most importantly, the Ministry of Health as well. These are credible sources, not just getting information through a search web, because sometimes they can be misleading and also create fear rather than creating awareness. And we don't want that when it comes to public health information. So to avoid misinformation, we need to gain information from credible sources such as these. We also need youth influencers and advocates to collaborate with health professionals to create engaging content, organize online campaigns, and using catchy, clickbaits and words such as hashtag check your breast challenges, to make it more fun, because young people of nowadays, youth, we only love things that are fun and relatable. All the time, we don't want it to be all lecture like. Sometimes they tend to zone out of such content. They want it to be made with some form of a joke, attached with some form of an innuendo, that is trending at the moment. But how do we ensure that that message is still passing the accurate information that by partnering with health professionals. Health professionals will guide such influencers into saying, look, okay, we can vet this content you're putting out and it's very good, it's okay, it's passing, it's still within the limit of correct information and people can gain it, without, the issue of misinformation or false information. And then I'm going to talk about the importance of the use of relatable language to reach peers. Yes, like I've mentioned before, young people will love innuendos that are trending, something that can make us laugh as much as they're trying to pass us a message. And I'm going to, cite an example of Aproko Doctor. I think everybody knows Aproko Doctor. He's he's a very fun guy. He passes information in a very fun way, and that is why people constantly engage with his content. And even anytime he comes onto your your timeline, you're like, what is this one coming to talk about again? But then you stay all through the video because he's using trending lingos, he's using visual aids as well, and he's using relatable language. And then we talk about the how do you maintain this, digital, the young people on the digital space? How do you ensure that not after today, after the content you posted today, tomorrow, they are here again to listen to, this awareness video you are creating? The key is consistency. Consistency, accuracy, empathy. And I think, a lot of content creators are also utilizing these key words, key values to put out the content that they're putting there. And that is why they've built a strong community that are always there willing to listen to their information. So when it comes to health information, and accessibility, shareability, and stigma-free health information using digital platforms, we need to make sure that we use this, languages that are reachable to peers, that are relatable to peers. We need to collaborate with health professionals and make sure that we check credible sources for health information. Yes. Thank you.
All right, thank you so much. So the key is to make fun, relatable content from credible sources like WHO. Thank you so much. So I want to move on for us to hear from a development effort perspective. And so I'll move to Madam Abuna. If you could share, why should breast cancer be viewed not only as a health issue, but also as a development and gender equality concern? Over to you.
Yeah, okay. Thank you very much, Nadu. And I'd like to thank you for the opportunity and also thank you to all those who have joined us this late afternoon. Yes. So I think that issues of health in itself is not only a medical crisis or a medical condition, but it's a developmental issue. And when you have a condition that is disproportionately linked to women, then there are issues of concern when it comes to gender equality. And that is why the linkage between breast cancer and development and gender equality is a very straight line. It's not a line that you say that you have to go round to come to because the relationship is quite straightforward, and it's straightforward because breast cancer disproportionately affects or impacts women. First of all, when we were listening to Dr. Is it Clara? Sorry, yes, I'm very bad at names. Yeah, so when we're listening to Dr. Clara, although she tried to make mention of the fact that there are some men who also experience breast cancer, it's basically a disease that affects women, the breast of women. And so when we talk about the impact of the disease, in terms of the patient ratio, there are more women who are affected by the disease. And once it's something that affects women more, it means that women are at a disadvantage when it comes to the disease. And of course, when you are ill, then you cannot do what you're supposed to do. We know that women are caregivers in our homes. And so when a woman is ill, children suffer because they don't get the needed care in terms of education, in terms of health care, in terms of proper nutrition and stuff like that. And so the family gets hit, when a woman is ill. So apart from the fact that the woman herself loses her income when it comes to issues of sicknesses or breast cancer when she's diagnosed. Personally, she's affected, but the community itself is affected. The family that she's in is also gets affected as well. But I think that it's much more gendered also because of women's underlying issues of power relations, patriarchy, and other issues. So there are lots of barriers that women have to surmount even to be able to receive care. One, even to receive the information on prevention, because I think one of the issues that came up from Dr. Clara and Benita is the fact that early diagnosis prevents, or reduces mobility and mortality. And in terms of early diagnosis, we are also looking at access to information, how women are able to receive information on the various risk factors, that is one, but also the various symptoms of breast cancer. And so if access to information, especially in terms of even digital information, in terms of public information, is not, or is a problem, then you are very sure that early detection, prevention, early detection, even diagnosis and treatment also becomes a problem. And so in terms of care, women are also disproportionately, affected when it comes to care. And then there's the issue of finance. We also have heard today that it costs a lot of money. And so the entire family will have to rally around, look for money to buy medications, first to even look at to do diagnosis. In Ghana, for instance, it's not all of our facilities that has the diagnosis equipment. And so sometimes even some of the materials will have to be flown to South Africa and other places before you could get that diagnosis. And this costs a lot of money. And we all know that women, studies have shown that women are at a disadvantage when it comes to disposable income. And so all these are barriers. So in terms of financial resources for diagnosis, for treatment, and also for even palliative care, if need be, are all issues that affect women and does not allow the woman to develop as it's supposed to be. And all this fosters gender inequality. But when we look at the issue of development and its relationship with the health or breast cancer, we are also looking at disposable income at the expense of government. We all know the adage that goes that it's easier to prevent than to treat. And of course, it's less expensive to prevent than to treat. And so when the burden of health becomes bigger on the government or on the health system, it means that government needs to invest more resources in terms of treatment of breast cancer, at the disadvantage of other developmental challenges as well. So in terms of socioeconomic or developmental impact, it's also at all the levels. We have it at the lower level, which has to do with a woman who has the disease. It also has to do with the family, the children, the family in terms of income, in terms of care for the family. And even in terms of the family cohesion. Because once a member of the family is not well or is terminally ill or is ill, you realize that even the psychosocial effect that it has on the family is something that would need care as well. And so at the family level, we have that impact. And then we also have the issue of loss of income for family, apart from the survivor or the patient who is ill. Family has to rally around and find money. Family run into debt. There is then the issue of poverty set in. There is the issue of the cycle of poverty that gets started or probably continue as well. And of course, unfortunately, if the woman dies, then we also understand the effect that it has on the family and the children as well. And in terms of the community as well, it affects the community well-being, and then it creates a ripple effect that hinders the developmental process of a country. And as I mentioned, resources that were supposed to have been used for other developmental projects obviously goes into health and other things. And one other area that I wanted us to look at also has to do with the issues of public health and developmental challenges, or the linkages between public health and development. And we all know that issues of cancer is a public health issue. And issues of public health or issues of health is a basis for all the SDGs all the 17 SDGs as we know them. Although they affect a few of them directly, in terms of good health, in terms of they are linked to gender equality, because we are looking at women being disproportionately affected. So issues of gender equality also comes in. And then also we have issues of decent SDG 8, which is decent work and economic economic growth as well. When a survivor is not able to work, when his immediate family members are not able to work but supposed to take care of her, disposable income dwindles and families are run into debts, and so sometimes they lose their livelihood, and that becomes a challenge for us, as well. And I think that breast cancer issues are also developmental issues and also seen in the gender lens, because governments must look at it holistically in terms of developing comprehensive national strategies. It's not a medical issue, as it were. It's a developmental challenge, and it must be treated just the same way that we treat all developmental challenges. So we need to have national strategies. And thankfully in Ghana, we have the breast cancer, the cancer control strategy, which is from 2021 to 2025, which leads both the advocacy, the preventive activities, the diagnosis, and also the treatment of breast cancer. But I think that the most important thing when it comes to issues of advocacy is that we also see it more as allocation of resources. How much resources is allocated to the issues of breast cancer, or the issues of the cancers? Let me put it that way. Political will is needed. I'm not sure how much of that political will we have as a country, judging from the many developmental challenges that we have. And so I think that in a nutshell, it's not only a disease, but it's a reflection of our structural inequalities. And the structural inequalities because, one, the disease affects women disproportionately. Two, apart from personally, in terms of family, and we understand the place of women in the family as the bedrock, of a family. So once the woman is affected, the family is also affected as well. And we understand also that it affects economic activities, it affects issues of education for kids, but even for the family itself. And I'm sure I probably will have time to look at also how it affects us with the issue of galamsey and its related issues. Yeah,
Yes.
unfortunately, Dr. Clara is not a Ghanaian, so she wasn't able to link Galamsey to the issues of cancers.
Yes.
And I'm sure it's something that we can look at going
Yeah.
forward. Thank you.
Yeah, so hopefully I'll pass on to the Dr. Woba would be able to touch on that for us. So he will more bring the in terms of breast cancer and anything, like delve more into the Ghanaian perspective or situational analysis. So let me move to the next pass it on to Dr. Francis Woba to share with us what are the most effective evidence-based approaches to breast cancer prevention and early detection that young people and everyone in general should be aware of? Then hopefully you can also touch on for Madam Abner's point, like in terms of what role does the current rise of galamsey play in increasing risk factor for breast cancer? Over to you.
Yes. Hello. Good evening to my fellow panelists and good evening to all our listeners. I am really excited to be a part of this conversation. And as you have rightly pointed out, breast cancer as part of the group of non-communicable diseases has taken a very huge toll on us as a country. And as my previous speaker has already alluded to, there is a disproportionate level of burden of the disease when it comes to breast cancer. Women are more affected than men are, even though, yes, men also do suffer breast cancer. However, I would just want to touch more on the clinical journey of breast cancer in terms of the disease burden. Generally, as we have previous speakers have alluded to, this is as much as a medical problem as much as it is a social problem. And there are several facets to it when we talk about the detection and management of breast cancer. And these facets involve a multidisciplinary team, typically involving both the clinicians and non-clinicians, particularly social workers as well as social services. Now, the reason particularly also being that if you look critically, most of the persons that bear the brunt of this disease also do not have the resources to be able to care for themselves should they get this disease. We have spoken about the fact that the disease journey generally starts from the fact that we seek to create awareness. And for those that get the disease, we seek to increase survivorship. And for those who go past the point of survivorship, we consider palliation. Now, it's important that we look at this natural progression of the disease. Ideally, we would focus mainly on the preventive strategies and prevention. So then would look at the concept of awareness and empowering the woman. And a lot is being done in this space with regards to breast cancer. Most facilities, most social groupings, and most gender groups look to empower women to be able to do the self-breast examination. And this is a very, very powerful tool where women are empowered to know their bodies, to know what the normal breast feels like, and report early enough if they do detect any anomaly. Now, this is important because that is the bedrock of early detection, empowering the woman through public education and self-empowerment. Now, in some instances, some fall through the cracks and then may not get this message. Some also may get the message, but may fail to pick up the condition much early. And then it proceeds to some level of breast cancer of varied severity. Now, in that sense, we then tend to look at the options of the services available to improve survivorship or survival. Most of the methods currently available include both the conservative and the radical options for the woman. We look at breast conserving options or radical options where it may require taking out either a part or a whole of the breast. That would require either surgery, a mix of surgery and chemotherapy, or a mix of surgery, chemotherapy, and radiation. In some cases, we add on hormonal therapy, dependent on the severity or the kind of breast cancer that it is. When these surgeries are done, the tissues typically are sent for analysis for histopathological analysis, that is analysis of the tissue, to give a determination as to whether additional treatment is required to improve survival or otherwise. Then we have the third group, that is those who don't fall within the awareness group or the early detection group. We miss them at the early detection stage. We miss them at the survival stage, or the survival surgery is not comprehensive enough, and then it means that beyond the surgery, what then holds for them is the fact that very, very little can be done in terms of improving survival. And so then we talk about what we call palliation. So we talk about palliation when there is the disease burden, it's so advanced that any form of treatment may be detrimental to the clients. And so we tend to then look at the options of how do we make you very comfortable with regards to the rest of your days that you are going to be with us. And while we continue to look forward to new advances that may come, that may be able to help. Now, we say this because in some instances, you notice that, yes, we would advise and say, this is not operable. And so therefore, we need to go to palliation. But we always give the caveat that a doctor's advice is only as good as the evidence available at the time of the advice. If new evidence comes to the fore, which shows that there is something else that can be done, then it may require that we revert back to a form of treatment that may improve the survival. Now, beyond these three scenarios, I just want to delve into the very first two, which is the awareness creation or early detection, which is what most of the speakers have already spoken about. So I'll touch briefly on that one. It is important that the bedrock of early detection is empowering the woman. If a woman knows and can do this self-examination by herself, or she feels comfortable, financially, socially empowered, and can seek healthcare, then it makes life easy for the woman. Here in Ghana, we know the context in which we're talking about. A lot of women may not be so much empowered, and so they depend solely or heavily on their male counterparts to be able to have financial strength to be able to access the various services that we are talking about. And so it's important that once women are empowered, we know that they are able to take decisions by themselves and be able to access these services. The second group of women, which is the issue of when women develop the cancer, where the option of treatments are available. There have been so much advancements. Some years back, we just used to have a few surgeons who could perform these surgeries. But beyond performing these surgeries, you equally need tools which would enable these surgeries to be performed in a very safe manner. Then there is this inequity of being able to access even these services. Most of all the services that we're talking about when it comes to breast cancer are all within only the big cities. I dare say about 70% of these cancers, the treatment centers, are all centered within Accra and Kumasi. Are centered within Accra and Kumasi, and a few of the big towns. Then the question arises: what happens to all of the other women who cannot access these centers? Most of them, again, because they are not empowered enough, they don't even have the financial muscle, and they are unable to access these services. So there is a problem when it comes to the distribution. These centers that can provide these services are typically in the big cities. Beyond the fact that they are also in the big cities, most of these non-communicable diseases are not fully catered for on our insurance system. And so it's very expensive having access to these services. And because it is expensive, automatically that creates a barrier for a lot of women. And once that barrier exists, they seek alternative sources of treatment, which leads to further worsening of conditions that could have been treated much earlier. So they go beyond the survival point to the point where it becomes very, very difficult to do anything about. And so it's also important that whatever barriers exist, we need to, and I'm happy that the social workers and all are within on this call, so that we look at the fact that once we are here, we need to advocate for treatment of breast cancer to be taken up by the health insurance scheme.
Yes.
And I think this is a very important point that we need to really emphasize.
Thank you so much. Uh, so, Doc, I'll come back. Yeah, Doc,
Okay.
I'll come back to you. But I just want us to move on quickly to also hear from Gabna Lab to share with us want to when we had a survivor share testimony, and she did touch on the role of faith and spirituality and how support from her pastor's wife really supported her journey. And so my question to Gabna Lab is how can faith-based organizations and spiritual leaders support in the awareness and also encourage medical screening for breast cancer in general? Over to you.
Thank you very much, Nadu. Okay, so good afternoon, good evening, everyone. It's truly an honor to be part of this important conversation, especially during this month where we have the Breast Cancer Awareness Month. I would also want to thank the organizers for bringing faith and health together. I know we've had our previous panelists, our speakers also, delve deep into the
medical part and the health part. So it's really vital that we bring in the faith part, the emotional part, the, putting it together with health. I mean, these are two vital pillars of our well-being. For those of us that are Christians, 1 Corinthians 6 verse 19, always reminds us of the fact that our bodies, are the temples of the Holy Spirit. So as people of faith, we believe that life is sacred and that our bodies are gifts from God. And therefore, it is not, only wise, but it is also spiritual that we take good care of our bodies, irrespective of, any part of your body or be it your breast or any organ. And this month specifically, we're talking about breast cancer. So taking care of your body is a way of honoring the life that, God has entrusted to us. Yes, we had, a few talk about being hereditary because of our genes and all that. And that is why it is important to have those faith communities, those environment sets, just, being discussed right now. Imagine being alone. I mean, the fear alone, I remember when she talked about going for the test and within that time before the results could come in, oh my God, I could just imagine how Benita was feeling. I mean, she said she prayed a lot. At any point in time, when people are sick, I can guarantee you that even those quote unquote that are atheists, they care to question themselves again to see whether truly is there really a God somewhere or is there a deity somewhere that could take them out of the predicament. So in answering that, I mean there are just about 4 categories that I would like to put it. The power of faith in healing, it's very important. I mean, when we talk about healing, we often think of the medicals, the treatments, we talk about doctors, rightly so, yeah. But, true healing goes beyond the physical. It touches our minds, our hearts, our spirits, our emotions. So faith is what gives people that courage to face the illness, with hope instead of fear. That is what faith brings to the table. Because sometimes just the name alone, you can go to the hospital and something as probably as simple as a cough. I mean, the term that the doctor would call, you wouldn't want to go and Google it because the more you go and even Google it and they tell you symptoms, you're already thinking about you having tuberculosis just because it's a simple cough. But that is what faith brings to the table. It kind of like gives you the courage to face any type of sickness with hope, without letting fear take over. It also reminds us that we are never alone, that even in moments of pain and uncertainty, I mean, that God is present. For many individuals diagnosed with breast cancer, I mean, faith becomes that source of strength, comfort, and then resilience. All right, so that's as scripture tells us in Psalm 34, verse 18. The Lord is close to the brokenhearted and saves those who are crushed in spirit. I mean, this verse just beautifully captures every sense of spiritual healing. I mean, just to know that there's that deity or there's that spirit being that is there, to strengthen your body in the times of weakness. So faith doesn't replace the medical care, not at all. It just works hand in hand. And that is why we would also don't want to say that if you feel something in your body, you stay at home and say, I am going to pray about it so that it will just vanish. I mean, when you pray 1, 2, 3, and so realize that no, the more you are praying, even the bigger it is. I think wisdom just demands that, you just get your medical checkup. Because I also believe that the Spirit of God is what grants, the wisdom to our doctors, our practitioners, to be able to give us solutions to it, even though, I mean, God is the ultimate healer. So when you pray, before even a medical appointment, like, what Benita was saying, just the fact that, you're even anticipation of the results can even just kill you. I mean, they could. it is endless how your mind can just think of what the result will be and the effect of the results. I mean, considering the fact that she has children, I'm sure at that point in time she'll be thinking, what will happen to my children? Because this is not just the first generation. She already saw her mom go through it. So even with this one, if not for faith, I don't even think that maybe should have even be able to come this far, because the medical evidence is there and it was obvious that she was going to be the next in line. But she told herself that no, she was going to fight it. I mean, she saw her mom go through it. And I think that is what, faith does. I mean, it brings that kind of power into you. And then the healing power of communities. She talked about her pastor, talking to the pastor's wife and the pastor. It's good to have people around, and truly, and that's one of the beautiful things that community does. And it is also very important where we find ourselves, the churches, the locations, or the family that you find yourself in. For us in most of our churches, I mean, even if somebody comes up with a testimony, I mean, that's why we call them testimonies, those who have been healed, it is a testimony, because it's not just about the medicine. Because when you take two sets of people going through the same things, they're all taking the same drugs. One person made it, the other person did not. Why? Because one person told themselves that I am not going to allow this thing to get me down. Because sometimes it's losing the hope or losing the faith is also that what makes them go down quicker and end up losing their lives. So the healing power of community is very important. We have screenings all over the place. We talk about it in church, talking about sponsoring people who are going through certain, ailments, be it breast cancer or whatever the disease may be. It really makes them know that you have people on their side. So healing rarely is a solo journey. It really happens in warmth and relationships, where you have communities that accept the fact that people can go through certain things and they need our support to be able to go through that. When no matter the disease, especially I remember those days that there used to be HIV. When people talk about HIV, when you are told that you have HIV, you are already writing your will. People don't want to come near you. Some are even that serious. And that when they hear that somebody has that kind of disease, they don't even want to come 100 yards near you. And this is the reason why it is very important that we have, the necessary and important people around us. So our place of worship is not just a spiritual, sanctuaries, but it is a place that brings hope to people, compassion, support, and hope. And that is why it's very important where you find yourself. When you find yourself in a place where you think that place is toxic, they are not accepting, I don't think that you are compelled to still stay there. Definitely you have to be, in the right place. And I am looking forward to having more of these talked about, even in our churches, on the pulpit. All right, it just doesn't have to be about talking spiritual stuff, but really when we bring it to the physical, we have churches that are building hospitals, because we have found that the need is there. We are not just saying that pray it and then it will just vanish. No, as we are praying it, we are combining. As we are praying it, you are taking the necessary steps. You are going for your screening. But if you say you are taking your medicine, take it 2 times a day. My pastor's wife will tell you, if they give you medication to say take it 2 times a day, pray 2 times a day. As you are taking the medicine, you are praying. Don't just sit in your home and just say, okay, I'm praying about it, and everything will just vanish. So in conclusion, I would want to say that, as we reflect on the role of faith and spirituality in our healing, community support, we have to also remember that, faith heals, community strengthens, and really it is the love that sustains us. Healing begins from faith and action working together. So it's not just about staying at home, but you also need to open up that space, because sometimes people are willing to help, but those that are in the situation don't open the doors for people to help them. That's the other way I also look at it. So it's not just about the fact that the faith communities are not available. They are available, but we also need to get the information out there so that people can accept help. Help from, these communities. A cheerful heart, good medicine, but a crushed spirit dries up the bones. That's in Proverbs 17, verse 22. So I just look forward that every survivor, every caregiver that is present here would, this is not just going to be the end, but this will be just a reminder of the things that are expected of us, as Christians, as faith people, to go out there and support others. Thank you very much, Now.
Thank you so much. So, just a quick one before I go. So, just a key to faith heals, community strengthening. If you didn't hear anything, these are the words. And another thing I picked up was healing is not a solo journey. Thank you so much, Governor Lab. So, for the interest of time, and we are just a few minutes for this webinar to end, I just want to take 1 minute from each panelist, like takeaway message for our participants here, or even as we are streaming on YouTube, anyone that comes across the video, could be a survivor, any person. What is that key message they should take away from the conversation of breast cancer in 1 minute? So let me start with Ms. Halima, then I'll take it on and up. So over to you, Halima, in 1 minute.
All right, thank you very much, Nadu, for the opportunity. So I would like to encourage us to prioritize awareness creation first and foremost, always, because early detection saves lives and awareness drives people to check themselves, even when they've forgotten to. If we constantly make content about the importance of checking yourself for breast cancer, I feel like that reminder there being present for everyone, it will allow women to take charge, take control, and also check themselves and get what's it called, and get the right treatment that they deserve, and timely treatment as well, because they were able to detect it very early on. Secondly, is we need to come together as a community to support women who have been diagnosed with breast cancer. They need our support. They need the communities to mobilize themselves behind such women, to keep them strong, for them to be able to fight the good fight, to survive breast cancer, because it's not an easy fit. And thirdly and finally, we need to constantly shut down these myths and misconceptions that are flying around, so that there's no more stigma around breast cancer, there's no more culture of silence around breast cancer, and people are not spreading false rumors out there. So these are my 3 main takeaways and my 3 main advice when it comes to creating awareness for breast cancer, and also making sure that women get early detection and also get treatment as soon as possible. Thank you very much.
All right, thank you. And I can see you already showing awareness by dressing in pink. Okay.
Pink, yay!
Okay, so let me
Pinktober.
do, Madam Abna, in 1 minute, what is your takeaway word for us?
Okay, thank you very much. I have a few to share. So first of all, we would need to strengthen the entire value chain of breast cancer care. We need to start with prevention, creating awareness, as Alima said, in all areas. And then we also need to look at investing as a country, this one now is multi-country. So we need to look at investing in various innovations that goes to support the diagnosis, the treatment, and care for breast cancer. It's very, very important. Currently, it's so expensive. And it's more, for Ghana, for instance, more foreign drugs. So is there any way that the government, or we can look at innovative ways, context-specific ways that we could, find all these processes within our context, so that we can reduce the costs, and that makes it more accessible for women. I'm also looking at partnership between government, between CSOs, between private sector, and especially in financing breast cancer care. And also because it's more about women, and it's more around gender equality. If we want our communities, if we want our countries and our environment or our development to be equal, then we need to invest in gender responsive approaches, which would include specific care and support for for breast cancer and other gender related issues. Look for where the care is needed most, where the burden of care is bigger, and where we can support most, and see how we can provide support to survivors of breast cancer. So that will be my last word for today. Thank you very much.
Thank you so much. Dr. Oba, your final words for us.
Yes. So just to say that we need to create awareness and empower our women. The ultimate is primary prevention. However, if the disease does set in, there is secondary prevention, which is the treatment. And in Ghana, available, we're able to treat comprehensively breast cancer. We also are saying that let us take any lump we feel in our breast seriously. Seek the advice of medical professionals. And then let's brainstorm together, shared decision making, and then together we can help save our mothers. Thank you.
Thank you so much. So I'm back again, Governor Love. I like the soothing voice, so hopefully your last, give
Well,
us your last.
mine, I'm sure is going to be in 30 seconds, if I should put it that way. I think it's something I wrote down that I would want to read out. It said, as we close, let's all be reminded that faith and healing are not separate parts. They meet where love and action come together. Our faith calls us not only to pray, but also to care, to encourage, and to act. So when we support one another through awareness, medical screenings, and compassionate community, we become the hands and heart of God in this world. To every survivor, every caregiver, every woman still walking her journey, your faith matters, your story matters, and your hope lights the way for others. So may we continue to build communities where prayer and prevention walk side by side and where love remains the greatest healing power of all. Thank you.
Thank you. Like I knew I had to let you be there. And this sounds so and beautiful. Thank you so much, everyone. Unfortunately, we have to draw the curtains here, owing to time. But I do really appreciate everyone who has stayed us to the very end. And I know most of us have questions, and feel free to follow us, Repelled Unfiltered. Do drop your questions. I'll definitely get your response. You can even mention the panelists you want to give response to. I'll reach out to them and be sure to share the response back to you. So follow us on Instagram, TikTok, and X at ReproHealth1121, and on YouTube and LinkedIn at ReproHealth Unfiltered. If you check the chat, the link to our social medias have been kept there. Would really, really be grateful if you follow. It's a plea actually, especially for our IG. Mark Zuckerberg said we have to meet 1,000 followers so that we can host our live sessions. And so we really want to get that. So as many as can follow us on these platforms and keep in touch. We have a lot of beautiful activities coming up. And so be sure to stay connected with us. I want to use this opportunity to thank my speakers, my panelists. I'm so grateful just to say that when I reached out to them, none of them hesitated and didn't hinge. And it's only the love of reproductive health, and maybe just to toot my horn, say the love for me, that they are very busy people. And so I'm very grateful, from Dr. Carla to Madam Abna, to Dr. Woba, to Governor Love, to Halima. I met these people in an interesting and special way, and I don't take this for granted. I'm very, very grateful. Do have a lovely evening, everyone. And my name is Nadia Raja Adikomenu, and I was your moderator for today. See you in our next webinar. Bye-bye.
Bye, everyone. Good night.
Good night. Bye.
Thank you.
Bye,
Bye.
everyone. Nadia, thank you for the opportunity.
Bye.
Thank you,
Bye.
ma'am.
Bye.
Bye. Thank you.
Bye.
Night.
Thank you.